Hello, my name is Sharon Britt and I am a physical therapist here at Cone Health. Throughout my career, I have worked in different settings and with many different populations. One of my favorite populations is orthopedics. It has been exciting to see the evolution of joint replacement surgeries, allowing for improved outcomes, shorter hospital stays, and transitions to home where patients continue their rehab journey. We are here to help you make that transition safe, from hospital to home, and to set you up to succeed on your rehab journey. This section of the video is going to review your physical therapy session, PT session. When to expect your therapy during your hospital stay, what the therapy session will include, and what the expectations of therapy will be. We will also review, perform, and educate you on certain exercises that you will be expected to continue at home upon discharge. Of course, if you are watching this in preparation of your upcoming joint surgery, it is important to begin now to ensure you are best prepared for your post-operative recovery. Some things to consider preoperatively are maintaining activity as your pain allows. Keeping your muscles and joints as strong as possible is one of the keys to a successful recovery. Some of you have been involved in a pre-op rehab session. That is great. Keep doing what your physician or a therapist have taught you. For those of you who are not enrolled in a formal therapy program, that is okay. You don't have to have a formal exercise program to reap the benefits of activity. Keep walking and keep moving in your daily routine, and you can even begin some of the exercises you will see later in this video in preparation of your surgery. The day of your surgery. Both nursing and therapy will talk with you about the importance of mobility and initiate out-of-bed activities as soon as possible after your surgery. If your physician has talked with you about potentially discharging the same day of surgery, your therapy session will begin in the post-operative area, or we refer to this as the PACU. So let's review what it may look like if you're discharging from the PACU, meaning same day as your surgery. Nursing will communicate with the therapy team your potential readiness for therapy. Once you are awake, your pain is tolerable, and you have sensation and muscle strength returning in your operative leg, they will begin contacting PT to come and complete their assessment. Your first PT session. We will begin your therapy session by asking several questions about your home layout. If you have steps to enter your home upon discharge, what support you have available at home, and how well you are able to get around prior to surgery. We will also assess if you already have equipment, for example, a walker, a cane, or crutches, or if that needs to be addressed while you are here at the hospital. Most patients do go home using a walker for at least a short period of time for safety and to ensure correct muscle retraining. Therapy will then assess your operative leg for strength and movement and possibly begin some exercises, which we will cover at the end of this section. We will also assess and review the safest way to get in and out of the bed, as well as up and down from sitting while utilizing the walker. You will always want to push up with both arms from a steady surface, then slowly grab the walker upon standing. We recommend your caregiver be by your side the first few days to ensure you are steady and safe to get up and down and walk by yourself. We will then review how to utilize a walker for getting up and down and walking. Most hip and knee surgeries have orders after surgery to weight bear as tolerated. This means that you are allowed and can put as much weight on the operative leg as you would like. However, we know the first few days may be limited due to pain and returning your strength. Therefore, we begin with walker training for the first few weeks. We will teach you a step 2 pattern initially to ensure your operative leg does not buckle while walking. You will hear us instruct you stating, walker first, then the operative leg, then the good leg. Do not take big steps the first few days or use a step-through pattern until your leg is able to hold your weight and you can ensure it will not buckle. A gait belt will also be given to you so that you can use it at home for your caregiver to hold to you for safety while walking. If you are having knee surgery, your follow-up therapy sessions at home or at an outpatient clinic will continue to progress your walking to a cane or with no device as you are able. If you are having hip surgery, you will progress with the walker until you feel you are not needing it for support and slowly wean yourself off of the walker. If you feel you are having any difficulties with this, please discuss this with your physician. If you have steps to enter your home or within your home, we will review and practice those prior to discharge. Please be aware of how many steps you have, if there is a railing, and which entrance may be easiest to access. Exercises for your knee or hip replacement will be reviewed as well. These are exercises that you will need to continue at home until you see your physician and/or continue with your post-therapy sessions. Let's review a few of these basic exercises. Ankle pumps. Make sure the movement is slow and large with an intentional pause at the end range of pointing your foot and flexing your foot. This helps with circulation and preventing blood clots. Knee presses. Pressing your knee down into the bed or chair to make your knee as straight as possible while then holding this for at least a 3 count. Heel slides. While your leg is supported, you will slide your heel up and down on the surface while your knee bends and then straightens. Perform this slow and go until you feel a gentle stretch across the top of the knee and then down to the fully straightened position. You may require help with this one initially. Straight leg raises. Perform a knee press, and while your knee is straight, try to lift it up off the bed. Do not go high. This is not necessary. You may require help initially with this one. Hip abduction. We refer to these as windshield wipers. While your entire leg is resting on the bed or surface, you will keep your toes and kneecap pointing towards the ceiling. Do not roll your leg in or out. While sliding your straight leg against the surface, slide it out and then back in. You may require help with this one initially as well. You will also progress to some seated exercises. Knee extension. While seated and your thigh is supported, try to straighten your leg and then slowly lower it back down. Slow is also important with this one. You may require help as well. Knee flexion. In the same seated position, we will show you the importance of making sure you achieve knee flexion, bending, by performing slow and steady stretches, holding for at least 20 to 30 seconds. Never force or bounce in this stretch. If you have had a knee replacement, we will review the importance of working on knee extension, which is straightening, as well as knee flexion, which is bending. It is important to not sleep or rest with a pillow under your knee. This may cause it to heal in a bent position. We may review some devices or methods to ensure your knee heals in this straight position. In addition, we will review and ensure you know how to get in and out of a car. Always using your walker and turning around first, backing up and sitting down slowly on the seat before placing one leg at a time in the passenger side of the vehicle. If your driver can push the seat back in its farthest position and recline it slightly, this will ensure you can get your legs in with less strain or pain. You may have other areas that you have concerns or questions about. Please feel free to write those down prior to surgery and bring this list with you. We will be providing you with handouts, pictures, and written instructions. We wish you the best on your journey with your hip or knee replacement.